Before anything else, let us separate what is confirmed from what is not, because a real family is living inside this story. I'm Dr. Harvey Jenkins, retired orthopedic spine surgeon and biochemist. Let's delve into this unfortunate incident at Ascension St. Thomas in Nashville, which left a patient paralyzed from the chest down. Confirmed by the hospital, 4 patients were harmed during joint replacement surgeries. The hospital reported the event to regulators the same day. It found the cause, added safeguards, and its chief executive has met with and apologized to the families involved. Reported by families and local newsrooms, but not yet confirmed by the hospital, that the drug given was potassium instead of the anesthetic Bupivacaine, that the mix-up happened in the pharmacy, and that one patient, a grandmother, is now paralyzed from the chest down. Hold on to that distinction as we move forward. First, let's look at when this happened. The reporting places this in the operating room, right as each surgery began, not in the clinic or recovery room. For a knee replacement, a single syringe of Bupivacaine is the classic spinal block. That is what this was meant to be for all 4 patients. It is likely 4 cases began simultaneously, and the pharmacy received orders for 4 spinal blocks and distributed them to those rooms at once. That injection goes into the space around the spinal cord, either into the fluid itself or just outside it. The deeper route is the least forgiving. And into that space, the reporting says, went the wrong drug. To understand why that matters, we have to look at the biochemistry. Here is the heart of it. Bupivacaine, the right drug, works like a dimmer switch for your nerves. It plugs the gate a nerve uses to fire and holds it shut for a few hours. The nerve itself is never harmed. The gate simply pauses. The drug eventually fades. The gate reopens, and feeling and movement come back. The whole point is that the effect is temporary. Potassium does the opposite. Every nerve runs on a potassium battery, kept charged by concentrating potassium inside the cell. Flood the space around the cord with it, and that battery collapses. First comes a storm of misfiring, which victims describe as intense cramping and pain. Then silence as the nerves depolarize and cannot reset. This isn't a pause, it's the beginning of cell death. The sustained charge throws open the calcium gates. Calcium pours in and triggers a self-digestion cascade. It is the same cascade that kills brain tissue in a stroke. The concentrated salt pulls water out of cells and narrows the vessels feeding the cord. The tissue does not pause, it dies. This is why the consequences of such a mix-up are so catastrophic. That is why this may be permanent. Bupivacaine leaves a living nerve. Potassium leaves dead tissue. The spinal cord, unlike a cut on your hand, does not regrow. Once a segment is gone, the cable is cut, and there is no splicing it. So how does the wrong drug end up in that syringe? And who answers for it? We will address the accountability in Part 2. Learn more about the physicians and patients affected by these policies at unbedsidemanners.com. Stay curious, stay informed. Please stay tuned for Part 2 of this investigation.